Hi, everyone. I'll let everyone get settled. Thank you all for being here today for our last Northeast CPI session of 2024. We can go to the next slide. As a reminder, we're recording this session and you'll have access to the recording after the session. Next slide, please. So if everyone could make sure that their Zoom name is updated with your organization. Our chat icebreaker question today to get everyone in the holiday spirit is, what's your favorite holiday movie? And as always, we're looking forward to a dynamic session. So please feel free to use the chat to raise your hand, come off mute. We would really love to get your feedback today and your insight, especially as we're thinking about 2025 planning. So I just love your engagement and participation. But as people are joining and we're getting settled, feel free to drop in the name of your favorite holiday movie. I'll give it a second. Elf, that's a really good one. I just watched that. Home Alone. Yeah, I think we have quite a few Home Alone fans in the room. Oh, yeah, all the Hallmark movies. Good. There are lots of really good ones. I need some recommendations. We can go to the next slide. So thank you for joining us. All of the session materials from all of the decks and recordings is available here in this folder. We'll drop a link to that in the chat. But right now, I'd just like to pause and see if there's anyone new joining us. If this is your first time joining one of our CPI sessions, would just love to say hi if anyone is new and would like to come off mute.
I'm not sure if you can hear me.
Yeah.
This is Debbie Murphy. I'm the new Community Development Coordinator. I'm going to be over the enhanced care management for our department once we get up and running. We're not quite there yet. So anyways, this is my first time. And I've also asked a couple others, someone just their first day will be doing the reporting for ECM. Katea or Kat is here also, and her supervisor, Rebecca. Thank you for having us.
Yeah, thank you so much for joining us. Anyone else new to the collaborative? All right, I think we can move on. So our objectives for today, we're going to reflect on our 2024 successes in delivering enhanced care management and community supports within the Northeast region. By the end of the session, you'll receive updates from partnership pertaining to ECM referrals and the ECM and community supports review tool and scoreboard. You'll all receive up-to-date details about upcoming cited round 4 funding, and you'll have some information related to upcoming webinars and related resources. And then we'll also engage in an initial discussion to set our 2025 collaborative goals. Next slide, please. So after we do our 2024 reflections, we'll move into those updates from partnership and then spend some time talking about cited and provide a couple other policy updates and resources, and then close out with 2025 planning and next steps. And I'll pass it over to Gretchen.
Great, thanks, Ava. Hi, everybody. Hope you're doing well this December and surviving all the crazy rain we've been having. It's really nice to see you all. So we wanted to go into our last CPI meeting of 2024, thinking about all of the successes that folks have had, the hard work that's been paying off, and want to take a moment to really celebrate what you all have accomplished. So we have a couple of things we can highlight here, but I would love to hear some more from all of you on the call today. So one of the things that we had Shasta Community Health Center share that they have been able to utilize recuperative care to really provide a continuum of care for individuals who are experiencing unsheltered homelessness and hopefully avoid hospitalization. We're going to cover cited round 4 later in our CPI, but we want to take a moment and recognize in cited round 3, we had 12 organizations across all 5 counties in the Northeast that were awarded funds. And that was a total of over $500,000 that came in through round 3. So that's new money coming in to build capacity and infrastructure. Round 4 will open in January. We'll cover that in a few minutes. And then we're also excited to see our CPI community growing. And last quarter, we secured attendance from 14 unique organizations and 14 new participants. So we're very excited to have that. And of course, we all have to measure our success as facilitators too. So we're going to actually go into the next slide into a poll to find out more about the engagement that you all have been having through the CPI. And I'm going to apologize ahead of time. We did a lot of polls today, but I know you guys are going to help us get through all of them. So over the past year, how many relationships or connections have you had with local providers due to participating in the collaborative? Ooh, I love the answer coming in so far of 4 to 6. That's fabulous. All right, we do have someone who answered 0. I'm hoping that's one of our new folks, and we're going to build your connections here through the CPI today and going forward. How are we looking for, looks like it's slowing down a little bit. Should we end the poll and publish it? All right, so a lot of you had between 1 and 3 and 4 to 6 engagements. That's really exciting. We hope to continue to grow that. And so if you have ideas of how we can do that, we would love to hear them. Great. Let's go to the next slide. So we did identify the 3 successes earlier, but I'd love to hear from all of you what successes you have had. And this includes partnership too, in terms of ECM and community supports that you would like to share from 2024. Anybody want to jump in and come off mute or put it in the chat?
Hi, team. I'd be happy to share. Hi, everyone. I'm Isabella. I'm from Mom's Meals. We're a medically tailored meal provider. And one of our big successes that we recently, it's a milestone that we recently reached in November, but we are now we have over 30 drivers within the state of California. And we're just super excited about that because all of our drivers come from within their communities. And so it was just awesome to have. I feel like 30 is like a big milestone number for us, just because that means we're getting the meals to all those people who need them. So thanks again for having us and for a great year.
Thanks, Isabella. That's great. Congratulations. Anybody else want to share a success? Can I call on our partnership team to see if you guys have any successes from the region for ECM or community sports you'd like to share?
Hi, everyone. I think from the plan perspective, we are just really happy that we expanded our provider network. I know that we increased both of our ECM and community support providers exponentially this year. So that was a lot, especially with our 10 expansion counties. And then our numbers continued to increase with the members that we're serving with both ECM and community support. So that was our 2024 success.
Wonderful, Ashley. Thank you. All right, anybody else like to share? Okay, well, if you want to add some things into the chat as we go through our session today, we'd love to hear them. I think it's a nice way to wrap up the year. In addition to sharing with the CPI, there is also a statewide success stories the state's putting together to really understand what's happening throughout the state and the different counties.
Hi, this is Marcy Kennedy.
Oh, hey, Marcy. Oh, you're going to share. Great.
Yeah, I wanted to share. So I have a client that's been in community support the past year, 2024, and she was living on the streets in a tent for the past 8 years. And I recently got her into transitional housing in a tiny home where she's super happy and has been assigned a case manager that's also going to do some wraparound services with her as well. So yay.
Wonderful. Well, that's
Yeah.
great news.
Yep. Super great story.
Great way to end the year.
Yeah.
All right, so we'd love to collect more stories. If you want to share them statewide, there is a link to the past success stories, and I know Eva dropped it into the chat as well. But it's a great chance to write up the work you've been doing and the success you've seen from your work. So please let us know if you want to do that. We can help support with getting those submitted to the state. So we'd love to see more come from our Northeast counties. All right, so now I'm going to turn it over. Actually, we have one more poll because we have a lot of polls today. I did warn you. So then I'm going to give it over to Ashley to do her MCP updates. But Ashley, let me do one quick poll first. So one of the things we wanted to engage into is how referral coordination is going through the CPI. So want to get a sense of what is your current satisfaction level with local provider referral coordination in the county or service region. So we'd love to see, very satisfied to very dissatisfied. So let us know how things are going. And again, really appreciate everybody doing the polls for us today. I know it's not always fun. We have a lot of folks that are neutral on that and some folks that are satisfied. So that's good to see. Haven't gotten any of the dissatisfied yet. So that's positive. And hopefully as we continue to go through the CPI, for those folks who are kind of neutral about things, we can work on how to improve our satisfaction. Of course, if you have ideas or suggestions, we would love to hear from you. So it looks like the poll has slowed down if we want to share those results. All right, wonderful. All right, now, Ashley, I am officially going to turn it over to you to go through all of the great partnership slides. So thank you very much for attending today.
Absolutely. Thank you. Okay, let's go to the next slide, please. Perfect. So as Gretchen mentioned, we are going to go over our ECM referrals and some things that are changing within the new year, more specifically our ECM referral forms. And then I'll also highlight on the oversight review tool and scorecard. So next slide, please. Great, thank you. So as you may recall, DHCS did want the managed care plans to standardize our ECM referral forms. This is more specifically for the counties that have more than one managed care plan in them, just to make everything easier for our referring parties. So we are changing our ECM referral forms. Some things are still the same, so anybody can still make an ECM referral. It's still the no wrong door approach. And you're still going to submit the ECM referral forms the same way, which is either through fax or you can send it securely in an email to our ECM address. But the actual referral forms are changed. So the biggest difference is going to be that there is now an adult referral form and then also a children and youth referral form. So here you will see the SNP for the adults. And then just also a friendly reminder that adults to DHCS considers those who are 21 and older. So if you were referring a party or a member to ECM and they are over 21, you're going to use that adult referral form. And then if we go to the next slide, please. Perfect. That is going to be our children and youth. So that is going to be anyone who is under 21. So that is the biggest change. We will have our ECM referral forms updated on our webpage. And again, if you are a contracted ECM provider, still the same process right now. We definitely encourage you to identify your own members and enroll them into your program once the member consents. Next slide, please. Great. Okay. So also a new requirement for the managed care plans is to have an oversight and monitoring process for our provider network. So our ECM providers may be a little familiar with our care plan audits, but we are also going to have a portion for the community supports providers. So we have a new oversight program that's launching in Q1 of next year, which is right around the corner, believe it or not. So this is our ECM tool and scorecard. This is going to be what we are utilizing to review the different members that we are selecting. We will have advance notice of the providers that we are doing the oversight with, so you will definitely be notified beforehand. And we'll be going more in depth on the oversight and auditing process in later office hours and roundtables. But this is our ECM tool scorecard. It looks a lot like the care plan, so our ECM providers should be pretty well familiar. But if you go to the next slide, please. Thank you. This is our community supports review tool and scorecard. So I apologize, it's a little bit small. I'm happy to share these if requested. So they'll be going over different services and then also going through additional required documents as necessary. So these will be available on our website as of January 1st. But again, this new program is going to launch in Q1 of next year. Next slide, please. Perfect. And then if you ever have any questions, feel free to reach out to us at any point. Thank you, Eva, for putting those in the chat. But are there any questions that I can address today?
I actually have a question, Ashley, on the referral forms for ECM. If someone's working with a family, should they use the adult referral form or the children and youth referral form?
That's a great question. So it will be member specific. So if you're working with the mom, you'll use the adult referral form. And then if you're also wanting to enroll the child, you'll fill out that one for the child.
Great, thank you. Anybody else have questions for Ashley? Ashley, do you have any tips as folks see those scorecards and some things to think about as they get ready for the oversight that you'll be implementing next quarter?
I think for our ECM providers, since they have experienced, most of them, the care plan reviews, it shouldn't be much of a change. Community supports, I'm not super familiar with that oversight process, so I can definitely take that back to our community supports team and see if they have any tips and tricks that they can share.
Okay, awesome. Are any of our folks from the CPI, have you guys been preparing for this or have some best practices you've implemented? I'm seeing no one's volunteering to share, so hopefully we'll continue learning together about how to make sure we can, meet all the needs and get A+ on the scorecards. All right, if there aren't further questions, we can move on. I'll turn it over to Melissa for the next two polls.
Thank you, Gretchen. I forgot my camera's not on. Sorry if we're overwhelming you with polls. We warned you guys. So this one is around the referral process. So I know we covered this now, but we've also done a little bit of this during past sessions and really just want to see where you think your knowledge is of the steps involved in the enhanced care management and community supports referral process while participating in the collaborative. So we know that you join other sessions and things like that. But just want to flag all of this is going to be really helpful as we transition into 2025 planning. I will give it maybe 30 more seconds to get some more responses from all of you. And if you're new, it's okay if this doesn't apply, you can skip this poll. But it's also helpful to understand kind of where you're at currently. Okay, I'm going to do a 10-second call out and then we can close it out. All right, let's go ahead and just share where we're at. So some neutrals mainly strongly agree and agree. So I think Pretty good. No disagrees or strongly disagrees. It's okay. You won't hurt our feelings if you disagree. It's always helpful to see where we can incorporate additional learnings for you all. Let's go to the next poll. All right, so another question, this one is around the eligibility process. So your knowledge of the key steps involved in assessing eligibility for community supports and enhanced care management has increased due to participating in this collaborative. So we've done a little bit of this. I think we can do a little bit more. So just, again, trying to assess where you guys are landing. I know there's eligibility criteria for different populations of focus. And so if that's of interest, would welcome kind of hearing that in the chat too, if you want us to focus in on this a little bit more. I'll give it maybe 10 more seconds on this one. I do see some interaction in the poll here. Okay, let's go ahead and close this one out and share. So very similar to the previous one, strongly agree, probably neutral there. So just good to know we can continue working on this. And like I said, if you have specific populations of focus that you're interested in hearing more about, please use the chat and incorporate that there. It's also helpful if you have staff who are not aware of eligibility process knowledge to elevate that, and we'll continue bringing this into our sessions. Next slide. Okay, I think it's back to Gretchen.
Yeah, thank you, Melissa. And thank you guys again for doing the polls. We really appreciate it. All right, so we were hoping we might have just a few updates, but of course the state has been quite busy over the past couple of weeks. So we do have quite a bit to report to you all. The biggest thing I would like to focus on is PATH cited. I know we've been talking about this over the past few months, but it is the last round of PATH cited. We expect this will open January 6th and close on March 7th. And the state has really put out their priorities. And I want to just talk through a little bit what those are, and then, give you guys some resources too, if you're thinking about applying, where you can get some more information. So the round 4 priorities that have been published have been around doing ECM and community supports in rural counties. So I think a lot of us here today that we would fall into that category. Tribal partners and providers. Again, some of you may be working with those communities or in those communities, and those are also going to be a priority for the state. The state has these categories: statewide ECM needs, statewide community supports needs. And what they've identified, there's 3 areas they've really focused on. One is around the birth equity population of focus. So if you are serving that population or would like to serve that population of focus, that is one of the areas. The justice involved population of focus, that can be pre-release and post-release. They do want to get more providers engaged in serving that population. And then the last one is transitional rent providers. And we just found out yesterday that the federal government approved transitional rent for California, which is very exciting. So that will be rolled out next year. But they do want to help providers and counties who are doing this to really create the infrastructure to roll out transitional rent. So I'm encouraging everyone to look at all of those categories. They also would like to see us address county-specific gaps in ECM and community supports. And we've talked about those. You guys are probably pretty aware of where those gaps are. If you would like to see some information that's documented that the state is relying on, we do have a guidance document, which the link will be popped in a few minutes, and it's on the next slide. But that guidance document has an FAQ section at the end that does list the gaps that were identified by the managed care plans for each county. So you can reference that too if you're thinking about PATH cited and would I qualify, et cetera, et cetera. The other thing that we've heard from the state is they do want to prioritize providers in counties that have been underfunded and PATH cited before, that haven't received very many dollars. So again, I do think a lot of us here today are in those counties. And so we do have more points going towards getting the PATH cited dollars. So I want everyone just to think about this, be aware that it's coming. It is kind of the last round of some of these infrastructure and capacity dollars that will be coming out. Next slide, please. So here's a timeline for PATH cited, just to keep everybody up to date on where things are. The state has put out a bunch of different documents, which we'll cover in a few minutes, that are really helpful to help us begin thinking about, would we qualify for PATH cited? What are the chances of us being awarded? So we can look at all of those. January 6th, they will open the application window, so we can start to see the actual documents that we'll need to fill out. I know if you are not yet a contracted provider, you must become one or become one in the process of doing this to get PATH cited dollars. And so if you aren't contracted yet, you will need to get an attestation letter from Partnership Health Plan for your PATH cited applications. So I'm sure they would appreciate getting those requests in earlier in this process rather than later. So if you do need to get something like that, please reach out to our partnership team. And the state's also going to be doing a bunch of webinars to help us understand the overarching goals of this round 4 of PATH cited, as well as how to strengthen our applications. And we have all the links in the slide deck. And then in March, you will have the deadline, March 7th at midnight, to submit your application. We don't expect these funds will be available until probably the earliest in the summer. So this is not going to be a quick turnaround in terms of getting dollars out the door. So do keep that in mind as well. The purpose for PATH cited is really capacity and infrastructure building. So looking at, do we need to increase our workforce? Do we need to rent office space? Do we need other equipment to help us become successful at ECM and community support? So do keep that in mind. Next slide, please. So here are the webinars the state has put forth. We hope that you will sign up for these, even if you're still on the fence about, should I apply, should I not? I think these will give you some good information or good pieces of information to make that decision. So definitely the January 7th webinar, which is going to be the information session, I would encourage all of you to attend. Next slide, please. And then we're going to be doing a learning lab at Health Begins, actually this coming Friday at 10 a.m. to really have a peer-to-peer learning experience. So we have some providers who have applied for and received cited funding in previous rounds. It's a great chance for you to come and ask them questions. You can ask them about application pieces. You can ask them about reporting. I know that we've had Shasta Community Health mention the reporting has been onerous for them. So learning more, what does that look like? How can you structure that in your application to be an easier process? So I think it's going to be important to come to this and learn from folks who are doing this right now. So I think the link is in the slide deck, and I'm sure we'll drop it here as well in the chat. Questions so far on PATH cited? I really encourage everyone to just look at this carefully to see if it's a good fit for your organization. These capacity and administrative dollars are going away, and so I don't want anyone to miss out on the opportunity to apply for this. Any questions? Or anybody who's done PATH cited want to share anything that they've learned from the process? All right, well, we will just keep going. Of course, we have one more goal. So looking about funding resources, and again, we're trying to think about how we can help support all of you in getting the resources you need for your program. So we wanted to find out, how's your knowledge of enhanced care management, community supports funding resources, such as TA Marketplace, PATH cited, justice involved funding opportunities, has that increased due to your participation in the CPI? And again, don't be afraid to put disagree or strongly disagree. And if you have suggestions of how we can do things better, please let us know. I'm gonna give it 10 more seconds. I'll use Melissa's trick to see if we get any more folks responding to the poll.
It works. I saw one more come in, Gretchen.
I was gonna say, thank you. Oh goodness. Okay, so we can go ahead and end the poll and we can publish the results. So most of you feel that it's you agree that it's helped, or you're neutral on that, and we had one person who disagrees. So of course, please let us know how we can improve the sharing of information around these funding opportunities. Wonderful. All right. I don't have any more polls in my section. I'm just going to give you guys the good news on that side. So there's a couple other updates that I wanted to bring forth from DHCS. They're actually asking for feedback on some toolkits that they just released. And again, it's a great opportunity for you all to give feedback directly to the state on some things that can impact the work that you're doing. So one of the toolkits is around housing support services. And so looking at the data sharing guidance that pertains to that, how do we interact with HMIS and other data systems? So if you are involved in that and would like to take a look at this and give feedback, they are asking for feedback by January 8th. And then the other toolkit they are putting out for comment is the Reentry Initiative Toolkit. So looking again at how do we share data with all the different organizations involved in reentry activities. So check those out, due by January 8th. And again, I think it's a great opportunity to give your feedback to the state. Next slide, please. Oh, already you're asking great questions. Okay, so let me pause here for a minute. You want to learn more about presumptive eligibility or presumptive authorization? If you just want to come off mute, Loretta, and just chat, we can do that as well. So there's two different things that are going on. And so there's presumptive eligibility, which is looking at getting someone enrolled in Medi-Cal. And that's usually reserved for hospitals, and some of the clinics that are tied to a hospital may qualify for that. The other thing that's coming up that will become in effect on January 1st is presumptive authorization for ECMs. The state has gone through and said, what are some of the populations of focus and some of the matching providers that should be able to start offering ECM on the spot without having to go through the TAR process. And it gives them up to 30 days to provide ECM and then submit all the paperwork to partnership to get that formal authorization for ECM. Okay, so I am hitting authorization. Great. So there is a whole guide, the policy guide, and I do believe that that's been put into the chat. There's a lot of information about which organizations qualify for presumptive authorization for ECM and for which populations of focus. And actually, I'm going to rely on you here. My understanding is that there's no contracting needs to do presumptive authorization. Is that correct?
Yeah, I don't believe there will be any additional requirements there. I know that we are still having a lot of internal conversations, just what this is going to look like, make sure all of our software and our systems are up to speed for this. So we will definitely be sharing as we know more information.
Okay, wonderful. So again, check out the guide, the policy guide, to see if you would qualify to do presumptive authorization. Then we'll look forward to hearing from partnership once they have all their systems ready for this, how it's going to be operationalized. Does that answer your question? Okay, let me know if we need to talk more about that. Okay, wonderful. Thank you. Great. Let's go back to the slides. We can go to the next slide, please. And the other thing that I thought was really interesting that's been put out there is there's a free training course that's a resource for folks who help individuals apply for SSI or SSDI, and it's been shown to actually double the initial approval rate for folks who take this course. It is offered to the federal government, so I wanted to make everybody aware it is a free course, and if you are doing this type of work, this may be of interest to you or some staff. So there's a little video that you can look at to see if it actually would be good for you or your staff. And then you can register through the SAMHSA website. Any questions on that? Okay, well, I'm going to turn it over to Ava.
And I think actually first Melissa is gonna walk us through some 2025 planning.
Okay, here I am again with my polls. I'm so sorry. So in the past year, have you used any of the following resources created or shared by the collaborative? So as we've noted, we've shared a couple of resources and just kind of curious to see if you've used any of these. And if you haven't, again, that's okay. We're just trying to assess kind of where we're at with the collaborative this year. And if you have questions on any of these, because I know the titles may not match with what you've looked at, please let us know and we can kind of clarify that too. Do a 10-second countdown here to see if we get any last ones. I know Gretchen already threw me under the bus with my trick, so I don't know how effective it's going to be moving forward. Yes, Debbie, we will share a slide deck and a very opportune time to ask this question. We actually have a shared collaborative folder where you can find everything. Eva did link it in the chat, so if you want access to it now, you can actually go in there and get access to all of our slide decks and resources. So thank you, Debbie, for pointing that out. Let's go ahead and close this out, and then we will go to the next slide. Thank you, everyone. Okay, so we want to use the kind of last 10-ish or so minutes of this meeting to engage you all in some 2025 planning. So if you've been with the collaborative, we have been hosting this collaborative for 2 years now. At the beginning of the year and at the beginning of the project year, we were really focusing on planning around ECM and CS implementation, doing a lot of stakeholder recruitment and engagement. And then we kind of moved into implementation in year 2. So this year was about really implementing ECM and CS and defining where you guys needed support, technical assistance, sharing policy updates and things like that. And now in year 3, we are moving into implementation, but also looking at sustainability and how we can really reinforce the work that you're doing in the communities and also expand on it. So I'm going to invite those of you who can be on camera to turn your cameras on and or use the chat or come off mute to really engage in this discussion because this planning is more for you guys and it's really for us to just take what we hear from you today and implement it into the next year. So next slide, please. Oh, look at me. I said I wasn't going to give you any more any more polls. So in the last couple of sessions, we actually did some asset mapping and demonstrated local assets and resources available in your community and just kind of want to know whether you guys can identify at least 3 key local assets or resources. And so this is just a quick response, yes, no, or I don't know. And I'll spend 10 more seconds here. So I see all of the answers coming in. Thank you so much. Look at you guys. I love this. Okay, let's go ahead and close it out and move forward because I want to focus on the next couple of items. Next slide, please. Okay, so one of the first questions we have is, what are your top priorities and aspirations for the next year? Specifically, what do you envision the direction of your goals are for ECM and CS implementation? So this can be organizationally, regionally, just kind of curious to hear from you guys. I know you all have different goals, but want to make sure that we integrate your goals into our planning for the next year. Even if they are organizationally, I think they still impact others. And so welcome anyone to unmute if you've talked about this or have, just thought about it very briefly. Just really want to hear what you guys are considering into the next year. Isabella, do you want to come off mute?
Yes, absolutely. Sorry, I can't come off camera just yet. But what I was saying is I just think it would be really helpful. I think one of the areas that is a little bit harder to tap into are the like hospitals, clinics, and health systems, obviously for good reason. We know they're super busy. But I think it would be great to connect with like their discharge planners or those making referrals within their hospital, just because I think I've noticed a lack of common knowledge between, you know, the CalAIM world and then the hospitals and health systems. So I think that'd be a really great opportunity in 2025.
Absolutely. And we've heard that in other collaboratives and even in this space, the need to integrate the hospital systems a little bit more. Can I just get a raise of hand, and you don't have to come off camera or anything, maybe use the Zoom function if you are affiliated with the hospital system? No one on the line today. Okay, that's okay. Anyone else? Debbie, I see your comment. Did you want to unmute and share?
Yeah, just basically what I said. We're just hoping to make sure everything runs smoothly, get off the ground. We have all new staff. We're going to be onboarding our social worker here probably in early 2025. And like I said, Kat, who's just joining us today, and I'm just joining you today. We'll be doing the reporting. So we're just hoping everything gets off the ground and runs smoothly, and everything, you know, gathering all the resources, information to make sure everything is successful.
And Debbie, are you guys in the process of being contracted, or where is your status right now?
We are actually already contracted with partnership. Our issue was our contract with Collective Medical. And that was stuck for quite some time with county council, and there were issues there. And we're just basically getting that in the process of signing, finishing up on that. And then, like I said, onboarding, and we should be hoping to begin soon.
So it sounds like you'll need a little bit of capacity building, probably connection with other providers in the region, and really helping build up skill set for your staff. Is that a correct assumption?
Yes, I would say so. The person who was doing in this role before me did a lot of the basic building to get everything rolled out. So most of that is kind of in place. So I'm still trying to learn, because I'm just very new at all of this as well. So they're just trying to learn as much as possible, and yeah, collaborate as much as possible, make sure I'm hooked up with all the resources I need. And so this collaborative will be good for me and Kat and our new social worker. So yeah.
That's awesome. Thank you so much, Debbie. I think maybe the Health Begins team can connect with you in a one-on-one. We have a lot of resources for staff who are just joining CalAIM or are not as familiar with it as others are. So really would like to share that with you if you're interested in it, and we can also follow up. Lori, I'm going to invite you to share what you have in the chat. I know you guys are using the chat, but I would love to hear your voices too.
Yeah, we have a patient. We're Indian Health Clinic in Bernie, California, and we have a patient that was in the hospital, and I received a phone call from the case manager over there that they have an ECM worker that helped actually place the patient. So that was the first that I learned that they have ECM workers.
And sorry, I think I missed where the location. Can you share where they have the ECM worker?
Shasta Regional, that's in Redding, California.
Awesome. Tracy, I'm going to also invite you to unmute and share if you'd like.
Yeah, absolutely. So Mountain Valley's health centers, we're kind of based all around of Redding. I'm based out of our Bernie clinic, but we have another ECM provider who's also in Fall River. And we just hired and have been training someone for our Mount Shasta and Weed clinic, our area over there, and are hoping to hire another provider for our Tule Lake and Doris area. So it's really exciting to see our little tiny program expanding and offering services to people in these outer areas.
Yeah, that's awesome. I also invite you guys to bring in other staff. So because they are in other areas, it may be helpful for them to kind of connect and learn. I know resources are limited in the region, but we will also be sharing kind of a schedule of events, and you guys will be able to determine like which kind of staff should join sessions, or you can divide and conquer too. So really encourage you to have them join us if they have capacity to do that. So one of the other questions is, how can we as a collaborative deliver the most value in 2025? So over the past year, we've hosted some in-person sessions. We are planning on continuing those, but really want to understand what areas we should prioritize to have the greatest impact. And maybe I'll also invite Partnership Health Plan to share a little bit about their priorities and maybe how we can integrate some of Partnership Health Plan's priorities into this collaborative. Sorry, Ashley, I just put you on the spot.
No, it's okay. I think our strategy for the next year is just to continue growing our network. We actually have a CalAIM data analyst, which we are really excited about, and she is currently looking into all of our network data to identify any gaps with both provider network and populations of focus and community support services being offered. So we probably will have more information within the new year of where we are really looking to grow. I will say just right off the bat, I can say that our rural counties and also our children and youth populations of focus are definitely room for growth there, especially. So that would be where we would focus our efforts.
Thank you. I think that's super helpful. I've heard children and youth population of focus being of interest. Can I just get either in the chat or raise of hand function? Is there interest within this group for us to bring that into the sessions, kind of talk about it a little bit more? I'm just kind of curious to see where you guys are landing. Isabella said yes. Anyone else? Okay. So last question here is reflecting on your experiences over the past year with this collaborative. What aspects of your participation in the collaborative did you find most valuable? So I know a lot of people have mentioned the in-persons were the most valuable, just being in a shared space. So just kind of curious, and you guys can also use the chat again if that's easier. In-persons. Being in a shared space, okay. One more person and then I'll move on. Networking. Thank you, Shelley, for putting yourself up as tribute. Provider spotlights and the shared information and resources. Awesome. Thank you so much. So we're going to take all of this information and really aim to apply it to our 2025 planning and collaborative sessions. So next slide, please. So what's next? We do have a schedule of events, at least for the first quarter. So January 2025, we will continue some of the goal setting. Typically at the top of the year, we like to set an aim for this collaborative that we can really ground ourselves in. We'll continue with some of these policy updates. As you've seen, Partnership as well as DHCS has a lot of policy work that's coming down the pipeline, and really want to make sure that it's voiced over to you guys in an appropriate way. We'll have some general announcements, population of focus highlights, and really focusing in on cited round 4 technical assistance. As we mentioned earlier, this is the last round of cited round 4, really pivotal for rural communities to really use this funding and apply for it, because there is a priority for rural communities in this round. And then we'll do some office hours. In February, we are hoping to have an in-person convening. So please go ahead and save the date, Tuesday, February 18th. We are considering Shasta County as our first touch point, mainly given weather and implications of that sort. And so we'll do that first in person there, and then we'll move into other counties throughout the year. And March, similar to January, we'll kind of carry on some of the work, but kind of hone in on topic areas a little bit more here. So next slide. I think this is me, right, Eva? Is it still me? Okay. No more polls here, but we do have a request for feedback. DHCS typically sends out a PATH CPI participant experience survey. This survey actually helps us understand where we can improve the collaborative. I know we've talked about that a little bit, but this is more tied to DHCS and PCG giving us some of that feedback from you guys in an anonymous way. If you do participate in more than one CPI collaborative, you will have to fill out separate evaluation forms. I know this is additional work, so we would really just appreciate having you guys complete this as time permits. The deadline is December 20th, and it should only take about 10 minutes to complete. Next slide. Okay, I'm gonna hand it over to Eva to close us out.
Thanks, Melissa. So yeah, just a reminder to please complete that participant experience survey. I put the link in the chat by the 20th. And then we are planning to have our first session of 2025, our January session on January 21st. That registration link will be sent out in a post-session email, so please be sure to register once you receive that. And then also a reminder about the cited learning lab that Gretchen mentioned earlier on December 20th at 10 a.m. And that registration link is there as well. Next slide, please. And you'll receive calendar invites and more information about the sessions for 2025. But just wanted to put this here to give you an idea of what the sessions are going to look like, what that schedule for both sessions and office hours is going to look like for 2025. So you can sort of start planning ahead. Next slide, please. And then, as always, we're available for one-on-ones to provide any additional support or answer any questions that you or your organization may have. And then just a reminder that office hours is also a good opportunity to discuss things like funding opportunities, referral coordination, etc. Next slide. Thank you all so much for joining us today and helping us plan for the next year. We hope you all have a wonderful holiday season and look forward to seeing you in 2025. Thanks, everyone.